Hello, everybody, and welcome to Answers for September 7th, 2021. I'm Kevin Daly for PATH. In this edition of Answers, there will be a school update by yours truly. There will also be back to school tips for parents by our in-house advocate, Audra Mae Talbot. Our special guest today is Bryan Klimkiewicz, the Special Education Bureau Chief. As always, at the end, there will be time for Q&A with participants. Answers is brought to you by PATH, Parent to Parent Family Voices of Connecticut, a nonprofit organization which has supported children with special needs and their families for over 30 years. For more information about PATH, please visit our website at pathct.org. If you have any questions about this webinar, feel free to email me at kdaly@pathct.org. While you're online, be sure to check us out on Facebook, Twitter, and YouTube. And here's the fine print, folks. This webinar is not legal advice. It's not healthcare advice. In fact, it's not advice of any kind. This is for informational purposes only. Also, the webinar is the sole property of PATH and not to be used for any other purpose without the express written permission from PATH. Here's the school update for September 7th, 2021. It's been 19 months since the pandemic began and Connecticut schools closed their doors. Now that summer break is over and we begin a third school year living with the pandemic, let's look at the progress we've made. Starting with 1 year ago. A year ago, only 2 out of Connecticut's 205 school districts opened with full-time in-person learning. The remaining 203 school districts went with the fully remote model or the hybrid model. This reflects a trend that was seen across the country. In a poll of hundreds of school districts nationwide that was conducted by Education Week, only about a quarter of them reported opening with full-time in-person learning. A little more than a quarter of the school districts reported they opened in a hybrid model, and about half opened with fully remote learning. Meanwhile, in Connecticut, time moved on. By October 2020, about 45% of Connecticut school districts had shifted to full in-person learning. About half remained in hybrid mode, and only 6% were fully remote. Advanced to February 2021, 58% of our school districts had shifted to full-time in-person learning. About a third were still in hybrid mode, and only 6% were fully remote. In April 2021, the majority of schools had shifted to in-person learning. The vast majority, 75%. Only about 1 in 10 were in hybrid mode, and again, 6% remained fully remote. The trend was clear. School districts were moving to the full in-person model. This could be why, as the Connecticut Mirror reported on April 30th, the Connecticut Department of Education announced it was waiving the requirement to provide remote learning during the upcoming academic school year, this school year. So the last 19 months have been quite a journey, a long journey that isn't over yet. And along the way, we've learned a lot. In the early days of the pandemic, it was like trying to drive with the windshield painted black and only what's in the rearview mirror to guide the way. But it's not like that anymore. While we can't predict what the pandemic will do, we're better at containing it, and we're better at predicting what will happen when we do contain it. You could say we've entered a new age, an era when there are things we know and there are things we don't know, but we will find out. For example, the use of masks and face coverings in school. That's a hot topic these days. Healthcare professionals tell us that masks can reduce the rate of transmission when people are indoors in enclosed areas, such as classrooms. While the use of masks in school may be less than ideal, Healthcare professionals, they make a pretty good case for using them. So we know masking helps prevent the transmission of COVID-19. We also know some states have actually banned mask mandates in school. What we don't know is, and we will find out, is just how bad it will get. For example, only 2 days ago, USA Today and other media reported at least 1,000 schools across the country have closed for in-person learning since opening day. Could this be the tip of a growing iceberg? Let's look at the big picture. These 9 states in gray have statewide orders banning mask mandates in school. In these 14 states, there's a statewide order requiring masks in school. Connecticut is one of those states. In Connecticut, all students, teachers, and staff must use face coverings. In these 26 states, there is no statewide mask mandate. Decisions on masking are made on the local level by local school districts. One state, New Mexico, has gone its own way. New Mexico says that masking is contingent on vaccination. In other words, vaccinated students and staff at high schools are allowed to forego masks. Masks are still required for everyone in elementary school, regardless of vaccination. Put them all together and it's clear there is no one solution that all the states are following. And it seems for every policy, there's a lawsuit or an upcoming court decision or an opposition movement that's working against it. One thing that's safe to say is this map is subject to change over time. Bear with me for one more example. We know healthcare professionals recommend vaccinations to help prevent the spread of COVID-19. We also know that some states have actually banned vaccination mandates for teachers and staff. What we don't know, again, is how bad things will be. Again, the big picture. These 7 states have a statewide ban on vaccination mandates in school. These 6 states have a vaccination mandate. Teachers must be vaccinated by a certain date or undergo regular testing. Connecticut is one of those states. In Connecticut, all teachers are required to be vaccinated by September 27th or undergo regular testing. In these 28 states, there is no statewide policy on teacher vaccinations. The decision on vaccinations is left up to local school districts. In Oregon and Washington, teachers must be vaccinated by October 18th. I couldn't determine how they will handle teachers who can't be vaccinated for health reasons or other reasons. Put it all together, and again, you see another picture of disunity. By the way, the states in dark gray did not provide enough data to be included. Meanwhile, in Connecticut, there was breaking news last week, and it came from the Connecticut State Department of Education. Over the course of the previous school year, Connecticut schools conducted state-mandated assessments for the first time since 2019. That encompasses the time of the pandemic and a little bit more. And the results are in. As reported in the Hartford Courant on September 1st, the pandemic hurt student achievement. Students who attended school remotely were affected more, and students with high needs were affected even more. Now, who are these students with high needs? Of course, this category includes students with disabilities, but it also includes students who are English language learners and students who live in poverty or who are experiencing homelessness. Now, wouldn't it be nice to have the results for special education students only? But we don't. These are the numbers that we have to work with. Here are the tests that were given. These tests are normally given every year. This time, 4 out of 5 students were tested in person. The rest were tested remotely from home. Let's focus on the results of just one test, the Smarter Balanced Assessment, or SBAC, as it's called. It's for students in grades 3 through 8. The test measures proficiency in English, language arts, and math. and it follows the core curriculum. Here's a chart that reflects the percentage of students without high needs who were proficient in English language arts. For comparison, the line on top is the percentage of students without high needs who were proficient in the 2018-29 school year. That's the last year we had data from until now. And that number is 78%. The lines below reflect the latest testing broken down by setting. Students who learned in person, the hybrid model, and remote on the bottom. Clearly, the students who were hybrid or remote were at a disadvantage. This chart shows the percentage of students with high needs who are proficient in English language arts. The line on the top is their score from 2018-2019, which was 35%. The lines below reflect the latest testing, again, broken down by setting, in person, hybrid below, and remote on the bottom. And again, the students who were hybrid or remote were at a disadvantage. Comparing the drop-off in proficiency levels between the students without high needs and those with high needs, you can see the students with high needs were affected more by hybrid and remote learning than their typical counterparts. On to math. This chart shows the percentage of students without high needs who scored proficient in math on the SBAC. The line on top is the score from 2018-2019, which is 71%. The lines below reflect the latest testing broken down by setting. In person, the hybrid model below, and remote on the bottom. As with English language arts, the students on hybrid or remote were at a disadvantage. This chart shows the percentage of students with high needs who were proficient in math on the SBAC. The line on top is the score from 2018-2019. The lines below reflect the latest testing by setting. Again, the students in hybrid and remote settings did not score as well. Comparing the drop-off in proficiency levels in math between the students without high needs and those with high needs, it's clear that students with high needs were affected much more by hybrid and remote learning than their typical counterparts were. Now, it's important to keep in mind that these results are from just one test, the SBAC. However, it's reported that the results of the other statewide tests were on par with the SBAC. So what have we learned? Well, the results of the testing clearly show that in-person learning is more effective and hybrid and remote are less than ideal. What a surprise. No, it's not. This comes as no surprise to educators and parents, but this is just a lead into the rest of the story, which is a lot more disturbing. Since 2019, which includes all of the pandemic, student learning has declined overall, and learning by students with high needs has declined even more. I just wanted to make a few points. Any good teacher understands their students' levels of performance. They learn it in the same way we parents learn it, by working with the kids and getting to know them. Most teachers don't need state-mandated district-wide testing to know if their individual students are falling behind. They already have empirical evidence. A benefit of statewide testing is that it helps show trends that all the students are taking, and it helps with planning how to respond. Now that we have formal testing statewide that shows the pandemic had a negative impact on Connecticut students, many are asking, what are we going to do about it? There is some good news on that front. Some of it comes from the Connecticut State Department of Education. Back in May, just before the end of the school year, the Bureau issued guidance to school districts for special education recovery, steps to help ensure that special education students who were harmed by the pandemic will be able to catch up and make sufficient progress. Highlights of special education recovery include evaluations, training for school staff and parents, and taking advantage of extended school year and other programs, and thinking out of the box maybe. I'm going to ask our guest, Bryan Klimkiewicz, for details, so please stay tuned. Of course, a directive from the state, it always works much better when it's followed up by some funding to back it up. So it was more good news when Governor Lamont's office announced on August 2nd that school districts would receive more than $16 million to use for special education recovery. It was even more good news when it was announced in late August that Connecticut's state plan to use funds from the American Rescue Plan Act had been approved. This plan will bring in $369 million in federal funds to support Connecticut's K-12 schools, including students with disabilities. So what have we learned? We know the pandemic, excuse me. We know the pandemic had a negative impact on students. We know students with high needs were affected more. We know the pandemic had the greatest impact on students with high needs who attended school remotely, especially in math. We know that special education restoration is a work in progress. We know state and federal funds will make it happen. We also know that remote instruction, apparently, is a thing of the past, although school districts are free to offer it if necessary. And there are things that we don't know too. Will special education restoration be effective? You know, it's one thing to look forward with hope, and I do believe there is reason for hope. But true satisfaction doesn't come until we can look back and see that progress has been made. We're just not there yet. We're not at that point. There hasn't been enough time. We don't know how the course of the pandemic will affect schools this year. And will we see entire schools and school districts shut down again? As I said before, there are things we know and there are things we don't know, but we'll find out. Please join us on October 26th for more answers about special education. Coming up is my interview with Bryan Klimkiewicz, but first our in-house advocate, Audra Talbot, has some back-to-school tips for parents.
So welcome everyone to PATH, our webinar tonight. And I want to congratulate you on making it through summer, just like we did in our house. So I'm going to go through a couple slides pretty quickly, and it's just to give you reminders about what it is you need to do as parents and caretakers of children within the special education realm. Next slide, please, Kevin. So there's some basics. What I like to do with my clients as a special education advocate and also with my own children is initially set up either a team meeting or a PPT meeting just at the beginning of the school year so we can get everyone on the team on the same page. And also it helps with having everyone looking at the IEP if there or 504 plan if there's one present. And it opens the discussion. So what you can do as parents and caregivers, just look at your paperwork, make some notes, and then set your agenda going into that meeting. Another one is to create a method for homeschool communication, which I'm going to talk about how you can do that and maybe share some ideas about that. And then also, I just want you to expect there is a honeymoon phase. If you can get your children into school, which is also another problem, you're going to see that pretty much between 2 weeks and 1 month, it's when the demands get a little bit higher, that's when we start to see a lot of things. So we're going to talk about that too. Helps you get ready for the next phase. Next slide, please. So about setting up your team meeting or your PPT meeting, it is always, 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 always a good idea to set up a meeting with a school team, regardless if it's a new team or if it's an old team. I think it's good to start that conversation, especially with the new school year, even if you have done an ESY program. Emailing a request in writing to the case manager or the leader of your child's school team sets the wheels in motion. Now, when I say case manager, if you look at the front of your IEP, right on the cover page, it'll say who it is that's in charge of your child's school team. It's usually the special education teacher. If you're not sure who to reach out to, that's a good place to start. I always tell parents when, I'm their advocate, composing a list of your parent concerns or any important information you'd like to share with the team as part of an agenda for your meeting, regardless if it's a team meeting or if it's PPT or a 504 meeting. It's always good to give that ahead of time so the team has time to think about how they want to address those things. It's good because it creates the open communication. Next slide, Kevin. So when you review your paperwork, what I like to do is you look over your most recent IEP, even beyond that if you want to, but usually it's the most recent IEP because that's the one that's in progress. And also I want to throw in 504 as well. I didn't write that, but that's also very, very important. So IEP or 504, the progress notes from last year, which are an indication of where you left off. Those are the goals and objectives that were addressed last year. And you'll see either S for satisfactory, M for mastered, or maybe still in progress, or maybe they didn't touch on those goals and objectives. That's important to have that on your list. And those are the things you want to talk about. So what I would like you to do is when you look at those IEPs, your present levels of performance is part of your IEP. That's always a good indication of what your current status is as the student's current status. The related service grid is also very important to me because that's your duration and frequency that your child's getting those services, whether they're pull in or push in. If it's a consultative basis, that would be in a different part of the IEP, but it's also very important to have those things because you want to make sure you have a conversation about if those levels are currently needed. And if yes or no, they should be increased. And that's a discussion to have in your meeting. Obviously, you're going to be looking at those goals and seeing if those goals are still appropriate. Yet another discussion. And the other thing I think a lot of people kind of skim over is the accommodations and modifications page, which is your page 8. Accommodations and modifications are super important because this is your child or your student's accessibility, whether it's assistive technology, whether it's them having preferred seating, if they have an anytime pass because of anxiety, they need to go down to the social worker, all those things really should be put in there. And also team meetings, I like to have put on the accommodations page, team meetings that are in writing on your IEP. Another very important thing for those parents of us that have behavioral intervention plans for our children, the BIP should always be closely monitored and discussed very, very currently and where it's going to be going as the honeymoon phase wears off. Looking at the progress notes from the previous year, you should ask yourself, did your child master out any of the goals and objectives? If they did, then we want to keep it challenging. We want to keep them progressing. That's scaffolding. So if they did, then that's also part of the discussion that you'll have at your meeting. So those are just some things that you may want to look at going into your meeting so you're prepped and ready to go. Next one, Kevin. So when I personally, from my own 2 children that are in special education, I have to say part of the silver lining, if you want to find one, of the pandemic was getting a close bond to the school team for both of my children. And so I want to keep that going as my children go back into school and my clients go back into school. So that homeschool communication is imperative, and an ongoing conversation has to ensue between the school and home. And if your child's having a hard day getting into school, I think it's important for the school team to know it. And you also want to know some very specific information. So there's a variety of methods to establish and have effective communication, because that's what we're planning for. We want effective communication. Do you want an email or do you want a communication book? I call it the comms book here in our house because we actually have a handwritten book that goes to and from school. Daily or weekly? And what specific information would you like to know from school? I know a lot of communication plans that I set up for clients, parents are very unhappy because, yes, of course, we want to know our children have a great day and that they ate all their lunch. That's wonderful. But I also want to know, what goals were worked on in speech and language therapy when they got pulled out or pushed in for their services. I want to know what the progress was. Bits and pieces of information is so important. And also it creates a great way for you to have that circle of communication when your children come home. So you can have a conversation, or at least work on conversation with your children about their day. Because in some cases, we have children that have AAC devices. We have children that don't have a very high ability of verbal communication. So it helps parents have that in about what their child's day was like. And I want to just throw this in there. So remember to always be respectful to educators, because it goes a long way to building a common bond, because they're there for your child. Just like you're advocating for your child, you're asking to have feedback. They got into this business of special education because they care about kids. So sometimes, because of our high emotional content, it's our kids, so it's emotional knee-jerk reaction for some things. I think it's very important to always kind of take a step back and remember that. Next slide, please, Kevin. So after the honeymoon, you should expect the honeymoon phase after re-entry to school to last between 2 weeks to a month. Now, of course, it's individualized, so it could vary. That's usually a good time between 2 weeks to a month. I see that in my own kids. The demands become greater on the students, and this is where the maladaptive behaviors emerge. All those behaviors emerge at probably about 1 month for at least one of my kids. So then taking your proactive approach to this planning, not reactive, because after they occur, you're kind of stuck. After these behaviors already occur, then you have to scurry and have a meeting. That's why I believe in proactive. Make sure the team revisits the behavioral intervention plan, or BIP, at the beginning of the year, because you want that all set so your child can hit the ground running. And if something does happen and behaviors start to happen, you're already set, and they can redirect behaviors. They can communicate with you and let you know what's going on. So you can work as a team, home and school team. Next slide, Kevin. So a word about school refusal. What I found is my phone is ringing off the hook for children that are within the special education system, in Connecticut, but also like nationwide. And you already saw that in Kevin's presentation, but school refusal is on the rise, which, we also know that mental health needs are on the rise too. And it's, in my personal opinion, it's really a crisis right now. So those post full distance learning kids and the hybrid learning have created a large scale problem across the country. Children are already anxious leading up to the full in-person learning because they're afraid. They see what's happening. If they're just anxious. Maybe they're absorbing our anxiety. Who knows? But it's out there. Schools and families must work together to create an effective, yet understanding plan to mitigate the school refusal issue. And of course, each school refusal issue is different. The reasoning is different, but I think it's really important to get to the bottom of why the school refusal is happening. So a tool the school could use is a functional behavioral assessment. They could have, data collection. It varies on each child and whatever each root issue is. Higher level intervention may be needed on the IEP, yet that's why you need your PPT meeting, so you can do any changes needed to the IEP, or from outside consultative services. Now, I know from experience here as an advocate, there are a pretty robust amount of outside consultative services for school refusal programs, but it also has to come as a team first. You have to have a conversation with either your supervisor, the special ed teacher, the social worker, school psychologist, whomever is on your team. You have to have the conversation about why this is happening, and maybe a plan for even getting your child to walk into the school. and staying in the classroom, and then doing that in a step-by-step progress, because we don't want to create more trauma as we go along. We just really want to get these kids back in school, and back in school because they want to. So it's about finding their motivation as well and decreasing their anxiety. Next slide, please. So I sincerely want to thank everyone for logging on tonight, because I know it's hard this time of night. As a parent, I understand. And I want to thank you for joining me tonight, and Kevin and Bryan. Any questions or comments or concerns that you have, you can put them in the chat box. And at the end of this segment, I'll be happy to answer my perspective as a parent and as a special ed advocate. And I hope that you have a great year, and we'll see you next month for PATH. Take care. Thank you.
Audra, I couldn't agree with you more about what you said on communication. Establishing communication is so important. Communication really is the linchpin in the relationship between school and home.
I agree, Kevin. I think that, speaking from experience, I can say that when both of my kids were home and we were distance learning, because all the schools were in quarantine. Well, we were quarantining at home too, for a variety of different reasons, health reasons. I had a really great relationship with both schools that my children go to, because they reached out to me. I had questions about things. They were really Johnny on the spot about everything. And if they didn't know, they would go and find out. So I think going back into school, it's important to have that. That's why I have a communication book, or if, whatever pleases you, but if you want that in writing on email, you can have that weekly or daily email. I use a grid, actually. It looks like the schedule of my son's day. And within the grid, the service provider, whether it's the special ed teacher or the speech pathologist, OT, whatever it is, whoever is delivering the service, writes in the grid about what they worked on, about what he did to perform on that goal. Maybe he just had a junky day and he just wasn't into it, or maybe he had a great day, but it's very specific. And then also, the ancillary stuff that we as parents want to hear. We want to hear the progress, especially these days. We want to hear the progress. And I think it's good for school staff too, to see that everything they're doing is coming to fruition. Even with regression, there's hope. And, they're coming back. They're making their way back. And so in our house, we did deal with regression with my son. And it's nice to see that he's kind of coming out of it a little bit with the hard work of both the school team and, here at home in our outside services. So that's why communication is really important. It's good for everybody, I think.
I couldn't agree more. Thank you, Audra.
Thanks, Kevin.
Looking forward to your next report.
Okay.
And coming up next, Bryan Klimkiewicz, Bureau Chief at the State of Connecticut Department of Education. And here he is now. Hello, Bryan.
Hello, Kevin. How are you this evening?
I'm good, thanks. Welcome back.
Good.
Welcome back to Answers. Now, I know you're here to talk about the Bureau's state performance plan and the annual performance report. But first, I just wanted to ask you about special education recovery. What is special education recovery, and how will it help special education students who have fallen behind?
Well, thank you once again for the invite. It's great to be back, Kevin, and hello to the participants out there. I hope, as Audra said, that you've had a great summer and have had a positive start to the school year amidst all the challenges. And just wanted to first, before I start, again, thank all the parents for supporting their students. Parents, as we know their students the best, and they're whether they be pre-K all the way through age 21, and the great collaborative efforts between parents and the schools and our educators last year. I heard Audra mention team and communication over and over again. So that's really what it's all about in supporting the students moving forward. Around special education recovery, I'll just share a few points. of emphasis. And thank you for pointing out the resource that we put out last May, which seems like yesterday. Time is really flying by. I know the summer went by quickly for me. We are fortunate in Connecticut to have such a collaborative effort around the concept and the idea of accelerating learning. So last year I was able to be part of the leadership team, which put out a document that was called Accelerate CT. There are 5 main areas of Accelerate CT to kind of cover priority areas. One being academics in all the instructional activities. The second very important area is social emotional learning. So all of the needs where our students and staff need around their social emotional health and well-being. Family engagement, which was mentioned earlier as well. And then the area of technology. The 5th area, when that document came out, was around summer enrichment. So there was a framework put out with the collaboration. The governor came on and representatives to really send the message that we needed to work together to really think of creative and innovative ways to take students where they are and help them move forward based on the impact of the pandemic. So the Accelerate CT document is available resource on our website. We have an English and a Spanish version. On page 2 of that document is the Recovery Memo that you mentioned, Kevin, which outlines a process where I'll just highlight a few main points and then happy to clarify moving forward. One is we want to make sure students with IEPs and 504 accommodation plans have access to all the activities that school districts and schools and teachers have planned for students over the summer as well as the start of the school year and beyond. That may require a look at your son or daughter's IEP or 504 plan to ensure that their accommodations can avail themselves to those structures in place from the school district. There were a lot of fun activities, a lot of social opportunities over the summer. We wanted to make sure that students with disabilities had access, and if not, what alternatives were in place for students to kind of reset and regain and regain some skills in those 5 priority areas that I mentioned. So that's the first piece of the guidance that's very important. The second piece is the concept of recovery. We know that all students will not require special education recovery. There are some students that had minimal to no impact last year where they were in person throughout the year. They made progress on their goals and objectives. They hit their proficiencies and there was a plan all along. So we wanted to first understand, put that point out there. We do know, though, that there were many students that were services were either delayed, interrupted, suspended, or inaccessible based on the challenges of the pandemic. So again, we're calling in those circumstances parents and schools to come together to ensure that the present levels of performance in the students' IEPs are up to date with all of the available data that we have, data from parents, data from the students themselves, data that the school collected over the year last year, and compare that to where the student was prior to March of 2020. So that's a large endeavor, but it's an important one because we have to understand where students are before we're able to move them forward. Based on that information, teams may learn new areas of growth, the unanticipated growth for student. They may identify new concerns that weren't written in the IEP previously or weren't documented in the IEP previously. And so the idea is to take a look at the present levels of performance, ensure that they're up to date with the most up-to-date information, and then moving forward, does that student need either adjustments or an intensification of those services and supports moving forward to ensure they reach their annual goals and objectives? So teams have done that. Teams are in the process of doing that. Some teams may be getting underway of doing that. And again, there are still other students who really wouldn't necessarily need that requirement because of the success that they have had last year. So that's in a nutshell. Sorry if I was a little long-winded, but I just wanted to make sure how important it was that the special education recovery is in the context of all students having access to acceleration learning moving forward.
Okay, fair enough. Now, as I mentioned earlier, funding seems to be coming to support special education, and it's coming in waves, apparently, from Hartford and from Washington, D.C. What does this mean for special education students?
Yeah, it's really an amazing commitment and an amazing amount of resources that are coming through both federal and state right now to school districts. So last year, at the end of the school year, we piloted a special education recovery stipend, which a majority of our districts took advantage of in a very small amount. It was only a $20,000 amount. From that, though, districts were using really creative ideas to address recovery over this summer and through September 30th. So we're just coming up due to the end of that stipend. And even though that's a small amount, again, districts were really creative and able to stand up some innovative ways to support students over the summer. For example, transition activities on campus, on school grounds, where otherwise students may have lost, training for special education teachers in certain areas of instruction of reading. We've had opportunities that weren't normally able to be stood up in a district because of these small stipends. So we were able to expand that. And this year, under our first initiative, under the ESSER $2, we were able to commit $13 million to districts based on the number of IEPs in the school district. Districts would be receiving sort of a tiered dollar amount based on the number of IEPs that they have in their district. And if they are able to target those populations of students that were most impacted by COVID, there was even additional funding that's going to be able to be added to that. So we're really excited about this. We're looking forward to working with our local school districts around that. Again, it's, the dollar amounts there per district seem small, but they're able to make a large impact. So for our smaller districts, we're able to allocate $30,000, $40,000 for a medium-sized district, $80,000 for large districts, and for our extra large districts, if you will, $120,000 will be allocated. In addition to that, there will be additional funds for, on top of those figures, for plans that identify an impact for students who were impacted most by the pandemic. So we have an electronic grant system which we're able to allocate those funds to districts, and there will be an application that will be reviewed by the Bureau of Special Education to ensure that those criteria are met. And that's a support for districts in this area of recovery so that they're able to ensure that students have additional funds and resources to be able to make an impact. There's three other areas that I'll describe very quickly. The second area is around evaluations. So we know the district's ability to conduct evaluations were impacted based on the model of instruction that they were in, based on where the students were accessing their learning last year. So last year we piloted at the end of the year an opportunity for the RUSC Alliance to provide at no cost evaluations for students. So it's building the capacity of the local education agency. We were able to work with 6 districts through that pilot. This year, we're going to be able to expand that to reach more districts. And we're dividing the school district into 3 segments, if you will, the beginning of the year, middle, and end. And then a certain number of districts will participate in those at no cost to the district, those evaluations to assist in students who have either their 3-year reevaluation coming due or evaluations that were recommended by the PPT for students that are already identified. These evaluations would not be for the initial eligibility determination. So these are for students who are already identified and providing that assistance with evaluation. The third area is around students who have an identification of specific learning disability, dyslexia. So based on the number of students within the district, we're providing a stipend to districts to be able to provide additional tutoring in reading instruction in that structured literacy component that's so important for students with reading-based challenges. So that's the third area. And then finally, we know that there's a smaller population, but still a population of students that are accessing remote instruction that are in that high needs category. And we partnered with Department of Developmental Services to be able to support parents in the home in helping those students access remote instruction. So that's for a small population of students that are either DDS clients or have accessed DDS support through the helpline. And that's a collaboration between the district and the student and the parent. We did pilot that as well toward the end of last year. And we're excited and hopeful that that initiative isn't needed to the extent that it was when the pandemic first hit. But we know the reality is that there still will be students in those categories that will need from time to time to access remote instruction throughout the year. So Kevin, those are the four you mentioned in your presentation, the $16 million. That's a breakdown of the four initiatives that we've been able to roll out in pilot form last year that will be in full implementation this year. So we'll be working with the school districts so that they can apply for and access those funding streams over the course of this year and even the beginning of next year. There's just one other area, Kevin, that so that's the ESSER 2 funding of the $16 million that you mentioned. School districts are also received a bump in their IDA grant allocations that was from the federal government that goes straight through directly to the districts. That's in over $24 million for 611 Part B, which is students from ages 3 through 20 through their 22nd birthday, and for $2 million plus for our pre-K population. So the typical allocations that the districts receive through the IDEA, there's also streamlined these additional dollars specifically for use of students with disabilities. So we're really excited to see that. And we're going to be supporting the districts again in accessing those IDA ARA funds. So there's quite a few different, it's hard to describe without a visual, but we do have some visuals to capture what I'm communicating to you this evening. And we actually have plans for districts over the course of the next 3 months to ensure that they have all the information that they need and all of the support that they need to ensure that the dollars are used as efficiently and effectively as they can be.
Fascinating. It will be interesting to see how all this support work plays out over the course of the school year and just how much is recovered. Now, let's move on to the State Performance Plan, also known as SPP, and the Annual Performance Report, also called APR. What are they and why should they be important to parents of students with disabilities?
Yeah, so really, I want to thank you again for giving me the opportunity to be on with you this evening just to talk about our state performance plan. So that's SPP, and annual performance report, APR. So I'll use those acronyms from now on, but the state performance plan is a 6-year plan that describes our efforts to implement the requirements of the federal special education law, the IDEA. And the annual performance report, or APR, is a report on a state's performance across 17 indicators. So there's 17 specific data points that we are held accountable from the federal government And in turn, the state holds districts accountable on a yearly basis because everyone's goal is to improve educational outcomes for students with disabilities. This year, we'll be submitting in February our 6-year plan moving forward. So of those 17 indicators, we'll be engaged in a process where we're setting targets for each of those indicators and addressing improvement activities, again, all with the goal of improved outcomes for our students. So we have a variety of resources and one-pagers and infographics explaining the SPP APR, the different indicators, which I'll list just very briefly now, just very quickly, but we have a really nice resource, which is a one-pager. The indicators are often referred to by number. So indicator 1 is graduation rates. Indicator 2 is dropout rates. Indicator 3 are statewide assessments, which you shared a little bit of data, overall data today. Indicator 4 is regarding suspensions and expulsion rates for students. Indicator 5 is around school environments. So whether or not they have access, students have access to typical peers within their learning. Indicator 6 is the same environment issue, but with our younger population of students in pre-K. And indicator 7 is preschool outcomes. So equivalent to that, kind of the state assessment targets, we have a target for outcomes for pre-K as well. Indicator 8, some of you may be familiar with, of receiving a survey about your participation, meaningful participation in the planning and placement team process. Indicators 9 and 10 address disproportionate representation of disabilities overall and by individual category. Indicator 11 is referring to child find activities and ensuring that our evaluation timelines are meeting the requirements set forth within state and federal law. Indicator 12 talks about early childhood transition from birth to 3 for those that are involved with birth to 3 into the public school setting, as well as child find activities regarding that. Indicator 13 is our secondary transitions for our older population of students to ensure that their annual IEPs have the required components for students to be able to have a transition plan in place. Indicator 14 is another survey that that students receive directly 1 year from their graduation date to assess whether or not they're in post-secondary education, employment, or their involvement in the community. So very important to see what those outcomes are. And indicators 15 and 16 have to do with our dispute resolution process of mediation and our mediated agreements. So the resolution sessions and our mediation agreements. And then finally, indicator 17 is an initiative that the state takes on regarding grade 3 reading. So students with disabilities to improve their outcomes in reading by grade 3. So we have a state measurable identification for that, and we've partnered with UConn to support our work around the state systemic improvement plan, which is within the overall SPP APR. So within that, we are working with a small group of stakeholders to be able to give us input on targets as well as the improvement strategies. And for those that aren't involved in our meetings between now and December, we're going to be sharing resources and information through you, Kevin, as well as CPAC, as well as on our state website to keep people informed and up to date on our 6-year plan moving forward on all those important indicators around special education improvement outcomes. So we're excited. We're going to have recorded resources. We're going to have, like I said, one-page organizers, graphic infograph resources, and we're excited to hear directly from parents, from students, from educators to be able to submit our plan to the federal government, which is coming up soon in February.
Excellent. How can parents get involved in the process? How can they provide input?
So if it's okay with you, Kevin, what I would like to do is share some links of which will contain these resources. Again, I know it's a little challenging to hear all of this information verbally. We have some really nice visuals to go along with what I'm describing. So if it's okay with you, we can send links of information and resources. And as we begin to work with our stakeholder group, that smaller group of individuals that's going to be providing specific information around target setting and around the improvement strategies, we will be posting the input and provide an opportunity for the public to provide feedback as well. So what I would say is if we're able to share those links, you'll be able to access a web page that's designed specifically for the public to update you on our progress with that plan.
Okay.
And you can always reach out directly to the Bureau. We have a point of contact at the Bureau. As questions arise or as information comes forward.
Excellent. And what I will do for our participants who are with us now, I get a report of participants with email addresses. Anything that you would like them to see, I would be glad to forward by email.
Excellent.
Okay, so
yeah, I'll start with just a slide deck of the information we shared today. And one of the responsibilities we have, Kevin, which I didn't mention, is to ensure that that stakeholder group is representative of the state. So that means demographically represented, geographically represented. So we have stakeholders that include parents, advocates, educators, State Bureau of Special Education, as well as colleagues from other departments. So we do have resources in both English and Spanish. The meetings that we hold, we also will have interpretation at our meetings to be able to increase access. So if there are resources that you either have questions about accessibility or need in a different format, we really want to be responsive to those requests. I really appreciate you being able to share the resources that we have as we begin this process. So we're starting out, again, the most important thing is to make parents aware of what the SPP APR is, why it's important, and then our process moving forward, both in data and our improvement activities. And improvement activities really are the technical assistance and training that we provide to parents, students, districts, to be able to increase those outcomes and get those trajectories in the direction that we want them going for our students with disabilities.
Excellent. I see we have some Q&A and I'd like to get to it, but before that, just one last question.
Sure.
I understand that there is a new IEP form coming from the Bureau, a form that the school districts will use. It replaces the form that's currently being used and has been in use for well over a decade. When is the new IEP form coming and what are parents going to see when they find it?
Yes, so that we're, again, excited and anxious to move forward with this initiative around improving the IEP. You're probably aware the state has been engaged in this process of improving the IEP document over 2 years now. It started with some regional parent sessions around input around the current document template and a stakeholder group that helped us design improvements. And our goal was to create a document that was easier for parents and students to understand and easier for our practitioners to implement. Since then, we've partnered with PCG, which is Public Consulting Group, on standing up a special education data system to house that IEP template and document. Really, one of the benefits for parents is that there's a parent portal within this CT-SED system where parents will be able to access and important documentation and important documents like the IEP, like permission to evaluate right within the system, with a confidential code and a confidential access to that system for their student. So besides the IEP itself, it also provides an opportunity for us to collect all of the data we need for those 17 indicators, or much of the data we need for those 17 indicators around our state monitoring activities. So it's going to reduce the burden on the district end of submitting data to us, because we'll already have it right within the system. So we've improved the flow of the document. We've tried to make it a more user-friendly, remove all of the congestion that sort of built up over the years through fault of no one. Just over the years, as things get added, that the document got more congested and more technical, I would say. So we're excited about the different format and form. As on July 1, 2022, districts will begin to use the new IEP document in the new form. We have 2 trainings that are happening to support districts in this. One is around writing quality IEPs, and the other is around using the system CT SEDS that I described to you. The IEP quality contains a parent module, which walks through the new IEP and highlights all of the new sections. There are 22 districts that are standing up a pilot this year, and started the training already last week before, late August, they started the training. The 22 districts will also pilot the parent training of the IEP quality with parents from their districts. So if your district is part of the pilot, districts may be reaching out to you to be able to access and provide feedback on that training. Once we receive the feedback from the parents and the districts, we'll be offering that statewide as of after January, so in the spring of this year. We'll also be relying on our partners at CPAC and CERC to help support parents in this process as we transfer from an old document to a new document. PCG has some wonderful resources, again, one-pagers, information that parents will need about the new IEP and the new system, which we'll be rolling out over the course of the spring and next summer, leading into the statewide kickoff on July 1, 2022. So amidst all of what's been happening around support and activities around schools to support COVID, behind the scenes, this work has been happening to improve IEPs and IEP quality. So we know change is hard. We are going to be working very closely with our districts and our parents as we roll this out. But we haven't changed any of the IDA requirements, any of the IEP requirements. The requirements and the components of an IEP are the same. It's just now the structure will be different in how teams create and implement those high quality IEPs moving forward. One thing to add too, Kevin, before we get to the questions, is that in CT SEDS, IEPs and any other documents within the PPT process can be translated in real time into the top 10 languages in Connecticut. So districts won't have to take that on to be able to support parents in their meaningful participation in the meetings.
It's amazing how much IEP forms have evolved over the years. When I first started as an advocate a number of years ago, IEPs were not prepared electronically, they were handwritten. They used a form, and that form used carbonless copies. You had to press down really hard. There were 3 levels. And it seems the parents always got the one on the bottom, the one where if you didn't press down really hard, it was hard to read. Now things have gone electronic and they're going even farther. That's fascinating.
We've definitely come a long way. Yeah, we have many educators who were doing handwritten IEPs not so long ago. I mean, it seemed, time flies, like I said, over the summer, but districts right now have, all the districts are using a vendor to provide IEPs electronically. we at the state will be with PCG, as I mentioned, partnered to provide CT sets at no cost to districts moving forward. And it'll be aligned. All districts will be using the same system. That includes students who are in our approved private special education placements or charters or magnet schools. And there'll be different levels of permission and access based on what type of school and where your student is. But it's there will be a substantial change movement happening, and we're preparing for it this year. We built the system last year. We're piloting it this year, and it'll be implemented the year after. So we've been waiting for this moment, and we really need everyone's support and process to hear from parents and educators and you know, all the stakeholders on how this rollout is, you know, feedback on the rollout and what we could do to support them during this time of change.
Well, thank you for explaining that. Let's take a look at the Q&A. And Audra,
Sure.
would you join us, please?
Hi, I'm back.
Okay.
Hey, Audra.
In the Q&A, in the beginning, I see here, someone has been submitting questions in Spanish, and while I'm unable to answer them, it does point out a flaw in the Answers webinars. We should be more culturally competent, and this should be made available to parents with all kinds of cultural backgrounds, abilities. This is something that PATH is working on, and I think Spanish language is something we're going to be starting with. So while I wish I could be helpful now, or at least more helpful, please stand by. PATH is going to do something about that.
Kevin, I just want to throw in too, I think, you know, going forward for our webinars, having our things in Spanish, absolutely. Like, I totally agree with the person that was posting a lot of those comments, but I think it might serve us well also to have someone on our webinar that's a live translator for Spanish speakers, because it feels like that's probably one of the primary languages. You know, we know our new IEPs going forward are going to be the top 10 languages in the state of Connecticut, but you know, it seems like we should at least start with the Spanish speakers and address that. So we have resources of Spanish speaking people. I don't know what PATH does. I know I do, you know, an advocate that is a fluent speaker. So that might be an idea going forward too, just to, you know, let that person know that we're on it. And so we're aware that we absolutely want to increase your accessibility to this. So we'll be reaching out.
Okay, excellent, excellent. More Q&A. And you know, this is live. You're seeing this in real time, and so am I. I have a question. Kevin informed that some states are required or mandatory the mask if the student will be present. What is the difference between mandatory or required? Is this supported by any law? Well, the difference between mandatory and required is really a matter of semantics. And in my presentation, I was pretty much using them interchangeably. But the second part of your question is this required by law? Bryan, would you like to take a shot at answering that?
So I'm not sure I would like to take a shot at answering that, other than I will say this. I don't want to step out of my lane, Kevin, with a legal question, but in Connecticut, we know that masks are required for schools. So that's, you know, all students, and we have a FAQ document based on that order. That's an order from the governor's office. And the most important piece that I can speak to is around students with disabilities or students that have challenges wearing masks. Last year, our school districts and parents did an amazing job for the population of students that were unable to wear masks and needed accommodations, needed to be able to access. But there were also individual challenges around that. So what I would say is, even though that's a requirement, there are processes for exemption, and to work with your school district, whether it's a disability-based issue that a student has or a medical-based issue that a student has, and individual determinations need to be made and individual accommodations need to be considered. So again, school districts did creative work around that, as well as parents. I know I spoke with and heard from directly from parents, and that's part of the reason why parents decided to access instruction remotely last year, because of concerns or fears around the mask issue for their students. We know that remote instruction as a parent choice is not an option this year, but that doesn't preclude planning and placement teams from being able to make individualized determinations, again, for masks, for access to instruction within the IEP. So I can't speak to what's happening in other states, or, you know, the semantics, as you said, around the differences legally between a mandate, but I know that that information is accurate right now. And the governor's executive authority, based on the pandemic, expands through the end of September. There will be an update before that September date to be able to provide additional information around that. We're continuing to get input from parents and districts around the mask issue. We did touch base with superintendents right at the start of the school, and they were pleased with how the mask issue was being addressed to start the school year. They've had minimal complications, but even one complication is too many. So we want to be able to support all kids and all students to ensure that they can access in-person instruction to the extent possible, and then ensure that there's individual plans for students who are unable to. I hope that helps a bit, but not a technical legal answer.
Now let's see. Please make, well, here's a comment that backs up what we were talking about before. Please make sure that all this information is offered in Spanish. Documents, seminars, trainings, videos on the platform of the State Department of Special Education. And I hear you talking, and that should be done with all PATH materials too. Here's someone asking for a summary of the presentation by email. And I'd be happy to provide that to everyone. And by the way, this webinar, like all previous webinars, will be available on YouTube, on the PATH YouTube channel. So if you go on YouTube and just search for PATH CT answers, it will bring up all the answers webinars to date. How do I know my district is part of the pilot? I want the parent training. Brian, what pilot would that be? Do you recall?
So I mentioned that with CT SEDS, which is our new statewide special education data system that will support the new IEP. The districts, there are 22 districts that are piloting the system this year. So within that, a smaller subset of parents will be accessing the parent module training because it's all in draft format at this point. We have everything ready. It's ready to be tested. So it's only a very small percentage of parents that will be involved initially. So this parent may or may not hear from their district about this initiative this year. However, we have a state site that was going to be providing updates. On our state site, it lists the 22 districts that are involved in the pilot. It also will provide access and resources for the entire year to help students prepare, to help parents prepare for July 1, 2022. So you may not be able to access, if your district's not piloting. Two, even if your district's piloting, they will not be able to reach all parents. Only 25 parents will be involved in that initial look at the training material. And then after, in the spring, and for 5 years moving forward, we'll have that available resource for parents moving forward. So what I'll do, Kevin, is share the link to our IEP CT SED site on the state so parents can see what materials we have. And again, they may or may not be, it's not something that they should request through their district. It's something that they would receive information through the State Department through this process.
Okay, thank you. Thank you. Now, here's a question. What do you mean have a transition in place? My child is a senior and I feel lost when it comes to transitioning high school and adult program. What should be taking place now before the end of school? You know, Audrey, you deal with quite a few families and students who are going through transition. Would you like to answer that question?
Sure, I'd love to answer that question. So I'm going to start off with each case is different. You know, so speaking formally as a special ed advocate, and Kevin as well, you know, we see a lot of families that reach out to us, you know, in the latter part of high school, saying that, you know, nothing's really been planned. I think a good place to start is, you know, first of all, I'm happy to have an offline conversation with you, you know, just parent to parent kind of thing. And then, you know, you have to reach out to your school team. Again, it goes back to kind of my basic segment, the back to basics. You have to reach out to your case manager. You know, I don't know your case, so hopefully there's an IEP in place that you can tap into with those resources. But you know, it's also about assessing what the present level is, you know, what your current functioning is, and what the needs are going forward in writing the goals and objectives to align with those assessments, and then implementing those through the process, you know, of the, you know, the school team can implement those things and giving you feedback what the progress is from there. Assessment is a good place to start with that, to see where you are. Also, we actually had a webinar, I believe it was in May, Kevin, I'm not sure, but I know it's on YouTube. It's on the PATH YouTube site. And so I have to tell you, I personally learned a couple of things from Linda Ramler and our other guest, Walt Glum, who are my experts in transition. And so Linda Ramler is kind of the godmother of transition in my world in the state of Connecticut, because she's created programs through the UConn Center for Disabilities, Developmental Disabilities. It's called the UCED. And the UCED is a valuable resource to us as parents and, you know, for all school teams as well. And so Linda creates programs for transition, and she is an expert in the field. And so is Walt Blum, because Walt's lived it personally with his son, Nick. And also he's part of a variety, I think he's on the DD Council as well. And so he is a force of nature in the state of Connecticut in a variety of different places, but he also has a robust amount of experience. So just a couple of those things. And then, you know, also feel free to reach out. You know, Kevin and I are always happy to talk to parents about where do you start kind of thing, and what's your end game. There's a couple other resources that your school team will have, hopefully. I know from experience, there are a couple students that Kevin and I work with that are high schoolers, and they've done such things as life course, and they've done mapping, where you're getting the student input as well as the parent and the school team, because it's about their life. I think they should have input about where they're going and how they want to get there, what their wants and their dreams are, because this is their life. So there's a lot of resources that we can help you tap into. But again, a good place to start is give a call or an email to the case manager, and you know, they really should be kind of putting that in place for you. I hope that helps.
And
Kevin,
yes, please.
I just want to add a couple things. There was important legislation this year around transition also. So you may know that for students with autism, transition services started earlier than we were required to start earlier than any other disability category. And what happened this year in the legislative session was that was made true for all students. So any student turning 14 within the context of their IEP are required to, as Audra mentioned, have a transition assessment and have goals in the areas of post-secondary education, employment, and if required, independent living skills. So those are the 3 areas which we design into the new IEP. Students have to be invited at a certain age to the PPT as well. So in my presentation with a small p on the indicators, indicator 13 is around secondary transition. So we check IEPs on a yearly basis to ensure compliance-wise, those components are in every student's IEP. And now this year moving forward, that will be true for all students at that same age level. Won't be different for students with autism than other disability categories. And just a couple other resources in addition to what Audra mentioned is the Connecticut Parent Advocacy Center has training around transition, as well as our partners at STIRC, which is the State Education Resource Center. And your school district has, as Audra mentioned, always go to your school district. They should have the information that you need around transition and or be able to call in either training or experts from the region to be able to support parent training specifically on this topic. And then the nice part about indicator 13 is indicator 14 turns into what are the outcomes after students leave public education. So 1 year out, what is happening with our students, which is arguably one of the most important pieces is, was the IEP designed to do what it was meant to do in preparing our kids for their path moving forward? But Audra, you mentioned life course planning and MAPS and all of those different programs for teams to get together to be able to design that vision for students. So
yeah, thank you for bringing all that up, Kevin. Brian, the other thing too I wanted to throw in there is the age, the other end of that age, the 21 to 22. If you could, if you want to throw in, you know, how.
Sure. Yeah, so
Right.
there was a monumental decision in Connecticut called the AR decision, which came about just a little over a year ago to the date, where previously students can be exited from special education from when they obtain their regular high school diploma, 1, or when they reach the maximum age of eligibility, 2. So the maximum age of eligibility previously and under Connecticut statute was the year the student turned 21 on June 30th of that year. That would be reaching maximum age of education. That changed with the AR ruling, and now students will reach the maximum age the day before they turn 22. So that could be at any point in time. That could be depending on when the student's birthday is over the summer as the next school year starts. But there is eligibility unless they first achieve their regular high school diploma or reach that maximum age. And then if a student's eligible for adult services like DDS, as we mentioned, DDS programming can happen that day of the student turns 22. So it's no longer, you know, waiting from June 30th until that programming starts from the DDS on the other end. So it was quite a adjustment in an important decision in Connecticut that happened very recently.
Let's look at more Q&A. Here's a question. How often are the mask breaks in school? What is the proper mask to wear? And I think the frequency of mask breaks, I believe, is left up to the individual schools and the administrations there. But I wonder, Brian, if you could tell us, at least in your experience, what kind of masks do schools find acceptable?
So we have information on that I can send to you. It's addendum 11 in our guidance. And that addendum was updated by the Department of Public Health and the State Department of Education. So I can share that resource or make sure the parent gets that information so they can access it directly and see that, that document.
Fair enough. Now, here's it's more of a comment than a question. My child has never been invited to a PPT meeting. Now, Brian, you mentioned that at a certain age, schools are obliged to invite students to their PPT meetings. So depending on the child's age, they may or may not have been invited as standard operating procedure. Wouldn't that be the case?
Yeah, first of all, I would say there is no, I mean, as soon as you can involve your student, you should be able to do that. So as a parent, talk to your team. Again, students as young as pre-K all the way through the age of 22 should be aware and prepared and understand the PPT process and contribute to that in some way. There's many states have an initiative called student-led planning and placement teams, or IEP team meetings. We do have, that's a very successful model in reducing conflict, in ensuring that teams focus on what needs to be focused on in the planning and placement team process. It's a process that we endorse at the State Department of Education, and we would like to see expanded across the state. But I know Audra probably has experience in advising parents, depending on, again, the student's ability to understand and to contribute to the discussions around the planning and placement team. But if transition is being discussed at the PPT, which is now down to through that age 14, students need to be either invited or have their input obtained in other ways so that they contribute to those transition assessments, transition goals, and objectives. So there is no age that's too young, number one, and two, really work with your team to make sure that your student can be incorporated, their input can be incorporated in a variety of ways.
Brian, I adamantly agree with you. You can never start too young with this.
Yeah.
So my daughter is a great example of this. I told her that we were having a meeting about her, and she was like, wow, and she had so much to say to me that she wanted me to bring to the PPT meeting. And it was like, okay, I can do that for you, but why don't we just record it? And so I did that because, I wanted her to feel included, but I also wanted them to hear it from her, directly from her, because she delivers it so much better than I could have ever delivered it, if you know my daughter, right? So I did that, and I played a very short video for the team. It kind of lightened the mood a little bit, dare I say, and they understood her perspective on what she was accessing, what she wanted to access, and what her issues were, and it was perfect. And she was in 3rd grade, so I absolutely agree with you. And then on the other end of that, absolutely for transition. Even if you have a child that's so impacted, my son, so impacted with speech and language and communication, I think he has an AAC device. He should be invited to the meeting because this is about him. And they get his perspective. He may not understand a lot of the questions being asked at the meeting, but at least they're getting, he can type something out and give them some feedback about something. Maybe something's working for him, maybe something's not working for him, whatever it is in his goals and objectives, because we're working on functional life skills a lot with him. So, everybody's individualized, every plan is individualized. And I think the parents are the subject matter experts, which I'm known for saying all the time. And so, your children the best. So have them be part of this any way that you can.
Yeah, I agree. It's how young people learn how to advocate for themselves. And it's something they need to do. We parents aren't always going to be around. And learning how to self-advocate, that's important. I know many parents get that. I know one parent who, her daughter, like my son, started special education in grade 1. She made sure that her daughter was present at every PPT meeting starting in grade 1, even for the ones where the conversations were kind of tense. But by the time her daughter reached high school, this kid used to carry her IEP with her. And she had a number of accommodations and modifications. And if she felt a teacher was not giving her an appropriate modification or an accommodation, she would sit down with the teacher, they would look at the IEP, and they would talk about it. Now that's self-advocacy. It's an important skill to build. Back to the Q&A. How does and DDS, the Department of Developmental Services, get involved in my child's transition from high school to an adult program? And what is the role of DDS? Bryan, would you like to take that question?
Yeah, so the adult agencies play a very important role in transition. I don't know if there's time to get into the details around the requirements for DDS and for that type of support. But again, that's something that your case manager at your school, most schools have at the high school level, a transition coordinator also that can help. And DDS itself has a hotline, where you'd be able to speak directly to that organization and to that to the case managers to be able to provide the detailed information that you may be looking for. But DDS or other adult services would and should be involved in a student's planning and placement team as the student progresses through, to ensure that transition from high school to post-secondary or to employment is as seamless as possible. So they are DDS if your son or daughter is a client or would be invited to and hopefully participate in those planning and placement team meetings to ensure that those transition plans address the student's needs.
Fair enough. Now, Audra, earlier you had mentioned that you had heard from a number of parents who were dealing with school refusal, and they had asked you about what kind of things could be done to combat it. Am I right about that?
You are absolutely correct about that. In my role as a special ed advocate, we have established clients, and a lot of my established clients are reaching out. And what I'm finding is the fully remote kids and the hybrid kids are re-entering back into school. Especially, I'm in the Harford County area. So in our area, this is where the majority of my clients are, and our phone calls are coming from. School refusal. I mean, there's a lot of cases out there happening. And I think I have friends across the country. I have friends in California, I have friends in Alabama, and nobody wants to walk into school. And if they can get into the school, then it's hard to get them into the classroom and then getting them to sit in the classroom. So the first line that I'm telling everybody is talk to the school social worker, talk to the special ed teacher, AKA your case manager, hopefully, the school psychologist. You need a plan in place. And it's not just this cut and paste thing where it's, you can't just forcibly put your child in school. You're creating more trauma this way. And they're not going to want to do it. They're missing out on learning. We get that. But I think the other part of this too is that we need to be so sensitive and put our kid gloves on of just helping these kids walk in the building. That's really the biggest problem we're having. One of the biggest cases I have right now is just getting this student just to walk in the building. Getting her in the car in the morning and getting her into the building is just, it's reaching every aspect of the family unit. The parents are having a hard time. The school team is really trying so hard, but they're not having a lot of success. So what we're doing is we're having a PPT meeting, first of all, an emergency PPT meeting. And this district is wonderful. Let me just throw that in. They are so understanding and so collaborative, which I, as an advocate, love, because then we can get the job done. But we're having a emergency PPT meeting. We're coming together as a team to create a plan. plan A, B, and C. It's not just, let's shove her in the school. It doesn't work because she doesn't want to go and she's not going to stay in there either. And then what's the alternative to that? What are some outside resources? Which, to tell you the truth, this school, this district has really been great about reaching out to their outside resources. In my area of the state, there's school refusal programs, there's partial day programs that we're looking at, and so the resources are there. It's just a matter of having people know about them and then having your district collaborate with you in order to access them. So the first step, communication. So you got to reach out. You got to have that communication with your district, and you've got to have the communication with your child as well, saying, I'm here to help you. We don't want to make this harder than it is already. There was another example I can use where the parents just were like, forget it, I'm done. Let's just have them go virtual. And I was like, that's not really a solution, because I get it. I don't want to try to traumatize my children any more than I need to forever. Trust me, because it's such an emotional thing to have to go through this, because you are going through it with your child, but to send them back to virtual because they won't walk in the building is not a solution. It's just a Band-Aid. And so again, you have to work with a team, create a plan, a solid plan, and then a plan B. Get to collaborate and find your solution, not your Band-Aid. So, and again, feel free to always reach out. Kevin and I have a lot of resources. Brian, I don't know if you can add any resources to that on the state level, what's being done, but I'm sure you're fully aware of what a lot of these families are going through. And you probably already expected it too, going back to full in person.
Let's look at more Q&A.
Kevin, I apologize. I'm going to have to jump off in a little bit, but I have probably time for one more.
Okay.
But Audra, I just wanted to comment. That's such an important, topic of school refusal before the pandemic, accentuated by the pandemic. And we know that students, whether they're identified or not, are struggling with that issue for a variety of reasons. So there are a lot of statewide efforts around, the indicators that I mentioned around graduation and dropout are all connected to what you just said. It's ensuring that the students have the support to be present, to access their learning all along the way. So we do have points of contact in not only the Special Education Bureau, but also in the Student Supports and Services, which is there's a chief of Student Supports and Services, John Frasinelli, and his team collaborates closely with us around activities and supports for both parents and students around school engagement and all that's involved with that and all of the different challenges. But it's if we can't reach our students and be able to ensure that they're feeling safe, that they're accessing their instruction, then everything else is secondary. You have to be able to take care of those issues that are impacting, understand the students, and that takes a community effort from the parent, the student themselves, other community resources, educators, all working together to support those structures and support those student issues. But Kevin, what I will say is if there are additional questions, you can certainly forward those on to the Bureau, and we can either provide a resource or a written response at this point in time. And I want to thank you again for inviting me. It was a pleasure to be on, and all of the verbal information that I shared today, I'll definitely follow up with some links and resources as succinctly as I can around kind of the issues of the questions that you asked and around the SPP APR stakeholder process moving forward, because we want to understand directly from parents their experiences and their input and how to improve things moving forward. And now more than any time in recent memory, we have an influx of resources to be able to address these issues.
Excellent. Well, Bryan, thank you for joining us again. It's been great having you here.
Thank you very much.
Thank you,
Audra.
Brian.
It's good to see you. Talk to you soon.
Yeah.
Bye.
Thank you, Audra, and we will see you on October 26th for the next edition of Answers as the journey continues. Good night.